So the thyroid, remember, sits kind of at the base of the neck. On physical exam, it's been interesting doing these virtual exams, because even on virtual, we can have you guys look up and turn from side to side, and I can kind of see where right there, sort of at the base of the neck, there may be a bulge or something going on with your thyroid. If you're listening to me right now, maybe reach up to your neck and just kind of feel around the middle edge of the neck and see if you can feel your thyroid. But it sits right there, kind of under where your Adam's apple will be. That's where your thyroid is. It's a really important organ across the board. It's a really important organ for women's health. It regulates so many different aspects of our health, our hair, and we'll come back to that, our metabolism, how you focus, fertility, inflammation, and so much more. Now, what frequently happens is that many women only associate thyroid with weight. They start asking questions about their thyroid when they're starting to gain weight, or feel like they're not looking the way they want to. But the thyroid is actually a lot more involved than just in our weight. For example, let's take hair. With hair, we know that there's what I'm calling thyroid hair. And how do you know you have thyroid hair? Well, if you reach into your scalp right now and just pull, and the hair literally comes out in your hands, you probably have thyroid hair, meaning your thyroid is not balanced correctly. And that can be from either an overactive thyroid or an underactive thyroid. It's not necessarily one or the other, or even an inflamed thyroid. So thyroid hair is real. I've lived that one. I know what it's like. And it's something that shows as one of the symptoms of thyroid disease. Your weight is a part of thyroid, but it's not, I will actually say, I think I've seen this in research, and I've also seen it in practice, that where the thyroid plays into weight is actually a very small percentage. Weight is actually more holistic in how it develops. It's really a function of gut issues, other hormone issues, portion control, movement, stress, and so many other factors. But the thyroid is a part of that conversation, but it is not a major player in that conversation, but it does need to be checked and optimized. I think the cognitive component of thyroid is much more important than we give credence to. So many women, you may be one, men too, will start to lose words or start to feel like they can't remember things and can't focus. Maybe you were running a meeting and you were able to, hold your thought through an entire 1 hour meeting, and now you're sort of fumbling for your notes or things like that. But the cognitive component of the thyroid is a big portion of thyroid balance, and one to really pay attention to. Overall energy, I think, is a big piece of thyroid. I think feeling cold a lot of the time or feeling hot, that can be a part of a thyroid imbalance. And then inflammation. So we'll talk more about inflammation and how thyroid can contribute to overall inflammation affecting your health. We'll get there in just a second. And then thyroid plays so much into the other hormones. For example, if you have an imbalanced thyroid, you're more than likely to have estrogen dominance. If you have an imbalanced thyroid, you will steal from the adrenals and then have adrenal fatigue. And the thyroid is also very directly related to what we do or do not do with insulin.